Placement of a radix graft is a question we get often. We've marked out the superciliary creases here, which is where the starting point of the nose should be. And that should be where the furthest end of the graft is, the leading end. So in placement, we've put this on a small pair of forceps that we will be able to set in the nose, but we do want to be able to anchor that in place. So I'll take the converse. I apologize for the headlight, but basically we've taken a very little bit off the profile, and we are always much better off doing a little less reducing in the midsection of the nose and building up where it's weak in the tip and the radix than overdoing the dorsum. So what I'll do now is, could you just hold maybe that? That's good. So I've got my suture, and I'm going to look up into that optical cavity that we've created. It's a 5/0 chromic that we've placed on previously. And then what I try to do is try to pop through, okay, about 2 to 3 millimeters below that mark, small forceps place. And in doing so, we know, because the suture has been placed on the leading edge of the cartilage, a couple of millimeters below that. So if we put our forceps right up to the end of it, where we bring this through and we anchor it, that graft will then not shift from side to side or even move on the dorsum of the nose. Again, keeping in mind that the pocket principle, there's a bigger pocket, so we have to do something to secure it in place. And now we've put that graft in place. It sits there and has, in essence, lengthened the nose, minimizing the amount that we need to take off the profile. And what I like to do, needle driver please, is I just anchor this in place right up here at the dorsum. Put a little stitch, and now that holds my graft in place for the first week. Actually, yeah, for about the first week, but actually after a couple of days, that graft is not moving because it will be underneath the splint. Go ahead and cut that in. It just goes, so that shows how we place a radix graft in the nose, and then we will move on to do our osteotomies.